We're at CES 2018, and yesterday we learned that the most important piece of technology today is actually the flashlight. Yeah, I mean, there was a blackout at CES. That was the irony. So today I'm going to talk about democratized digital health data and what that really means. When you have a medical piece of software or medical device, you need to exchange data, and you need to be able to do that seamlessly. And right now, we know that's a big problem in healthcare. So before I jump into data, I actually want to talk about the state of mobile phones and mobile phone adoption. So the adoption and use of smartphones is pretty wide. We have about 95% of all Americans that are adults that have a mobile phone that can send and receive a text message. And then that number decreases to 77% of all Americans having a mobile device that can send and receive a text message, but also run a mobile app. And both of these applications, from sending text messages to utilizing mobile apps, can be used to encourage digital health behaviors. So what can you build on the platform? Once mobile started to saturate and become a true thing in the US, you started to see a lot of innovation with applications. So in those applications, you saw Uber introduce the concept of ride sharing and the whole sharing economy. You saw Instagram and Facebook introduce the concept of a social network and connecting people all around the world so that we can seamlessly always have a conversation or stay in the know of what's going on. And then you have food delivery companies like Eat Street and Instacart and Grubhub that allow you to seamlessly get food with the press of a button on your phone. You have telemedicine applications like Teledoc that allow you to speak with a clinician at any time. And then you have entertainment options like YouTube. And when you look at the app ecosystem, it's huge. But if we specifically focus on the digital health ecosystem, we'll see that there's 318,000 digital health apps that exist today. That's nearly double what was available in 2015. And not on this slide, but I took a look into it. There's 340 medical devices that exist today that a consumer can buy. And I'm sure that number's changed here at CES. But the breakdown is about 200 new digital healthcare applications are being added to the Google Play or Apple Store each day. And these apps power the digital health ecosystem, right? There's a digital health app literally for everything, from telemedicine to collecting patient data to clinical trials management and health condition management and general wellness as it stands. And what you would think is, we have the ecosystem, we have the data, we have the capabilities, we've seen it proven in other industries. Why does this stuff not talk to each other seamlessly? So when I entered the healthcare space 2 years ago as an entrepreneur, I was shocked. Healthcare did not work how I expected, right? Many of the hospitals have adopted electronic health records, but they don't talk to each other. And literally it's a struggle to follow the patient from the point of care, from one point of care setting to the other. And in more technical terms, we talk about this problem as interoperability. However, without it, the patients are frustrated, right? Because you get a medical bill 4 times and you've already paid it and you've heard the stories. Clinicians can't make informed decisions because they don't know what medication the patient's on or what's going on within their point of care. And it was really hard for me to comprehend this in 2016, that the concept that we could not really seamlessly know what was going on with the patient. And we couldn't share data. It was just archaic to me. And especially coming from marketing and just being in blockchain and doing all kinds of cool things previously, I was shocked because I could teach a 15-year-old how to buy a digital ad on Google Ads or Facebook Ads and literally track you on the internet and say, you know, you just looked at this Prada bag, and now I'm going to show you that Prada bag on all the different applications you use within a day. And that's not the state of healthcare. And the funniest thing, or the thing that like blew my mind, was how important the fax machine is in healthcare as it stands today. So I think we all can agree that the status quo in healthcare today is broken, right? And when you look at the intersection between patients, providers, and technology, you realize that there's a lot of commoditized relationships between patients and providers. When you look at the technology between providers, you see a lot of inefficiencies. A lot of doctors and physicians kind of don't like their EHRs. They say it's tedious, right? The process is not beautiful. Patience and technology, that has a lot of fear and apathy associated with it, that relationship. Whenever I Google something, I'm always freaking out because I think that I have cancer or some very devastating chronic disease. So overall, the status quo in healthcare is broken. However, software is at the intersection of all of these relationships. And I think it has the potential to actually dramatically improve healthcare, right? Because if we make software, we can actually change the relationships between the patients and providers. We can make it more empathetic. Providers and technology, we can increase efficiency. And we can also have empowered patients that actually are learning and making informed decisions to prevent certain chronic diseases from happening and occurring. And so at the intersection of all of this is software, and that's better healthcare. That's what I believe. And in order to realize this, we actually need the infrastructure and the ability to share and exchange data. So I believe Redox democratizes digital health data. And what we do is we provide the infrastructure to remove barriers to entry for technology innovators and digital health solutions to exchange health data and really create this technology meritocracy in healthcare, which equates to a better healthcare experience for us all. And so when you look at better healthcare, what can you build on top of the platform? Well, you have apps that can scale across facilities. So you can build your application once and you don't have to change it every time you sell into a new healthcare organization. You can securely exchange data between your application and the electronic health record. And you can swiftly deploy some of the best digital healthcare applications that exist in this technology meritocracy across your facilities if you're a CIO at a healthcare organization. And so how Redox does this is we provide an API and a suite of developer tools so that a developer or any software engineer, anybody that's integrating their healthcare devices or software, they can build once and connect everywhere seamlessly. So the Redox network is very fascinating because in the past 5 years, we've built a network that has over 800 healthcare applications and devices on it. And in that network, we've been able to connect to over 200 healthcare organizations. And from those 200 healthcare organizations, when we're managing the integrations, we've been able to take advantage of the lessons learned and go live quickly with the new customers that come on with our network, right? And when you look at the healthcare organizations, they don't all use the same electronic health record software. So we have over 40 plus EHR systems from the big three like Epic, Cerner, and Athena Health. And then we even have niche EHR systems such as Dr. Chrono and Caro. Redox supports them all. And when you look at our integration team, they have collectively over 150 years of experience in EHR integration. So integration is literally all we do. We don't offer any products. We just want to provide this ecosystem the ability to actually seamlessly exchange healthcare data. So I want to talk about a few use cases of the Redox network and what we can build on it today. And then I'm going to close out with my theory on the state of emerging technology in healthcare. So the first application I want to talk about is Twine Health. Twine Health provides a health coaching platform that helps prevent and monitor chronic disease. They joined the Redox network a few years ago, and it's been an amazing experience for them. Many people have known this. The next company I want to talk about is Teladoc. They allow patients to speak to a licensed doctor in a matter of minutes. They just connect via their web device or mobile phone, and you can just talk to a doctor anywhere, anytime. Telemedicine in general provides a wide range of benefits because when you're a patient, it's more convenient to get a check-in in your own home, and it's timely, right? Versus going to the hospital and having to just go through that whole experience. And it's also it also increases your access to doctors and be informed because you can actually have conversation and ask questions in a cost-saving manner. One of the more cutting-edge examples, I would say, is Gauss Surgical. So they've developed a real-time computer vision blood monitoring solution that scans surgical sponges and they provide an accurate estimation of blood loss during medical procedures. And that's all real time based on their computer vision algorithm and this iPad that they have in the clinic. So, in closing, I think we all hear stories about how digital health innovation is dead. And I kind of disagree with that. Because when you think about building a yacht, right, there's a point at which that yacht is just a piece of wood and fiberglass. And you have to think about the schematics of how you're going to go from a piece of wood into a beautiful yacht that we all can enjoy on a lake somewhere. And it starts off by the yacht builders putting together these pieces of woods, and they spend some time, they build the frame, and once they get the frame, after a few months together, they spend months putting the hull of the yacht together, and it starts to look like the second image. And after a few more months of them just walking around and making decisions, and it doesn't really look like much is going on because they're moving tools and nobody's really building the yacht, so you say, they come back and they call you and say, hey, the yacht's finished, it's outside. And the point I'm making here is that there's a point of visible activity that doesn't necessarily correlate with the period of when important things are being done and created. So in healthcare, if I go back to the various emerging technologies in the space, you'll see you have innovations such as VR and AR, which is still in the early stages of development, and it's very much a situation of us putting our digital healthcare yacht together and learning from what we know and testing theories. When you see machine learning and AI and computer vision use cases in healthcare, you'll see that we're moving out of the phase from putting the technology together to actually collecting the data so that we can do more innovative things and provide a better healthcare ecosystem. When it comes to voice and wearables and et cetera, we see that we're just trying to figure out where everything goes on this yacht and figure out who the owners will be. And then when you see a yacht like telemedicine, you'll see that the yacht is complete, and we're trying to figure out who's going to own it and what business models and use cases can be developed from it. So I want to thank everybody, but before I close and leave, I want to say one thing. So right now, we're at CES 2018. We're in the digital health community. You see that it's growing. We're adding tons of applications day over day, and tons of medical devices are being added to the ecosystem as we stand. I have a theory, and that theory is right now, our future selves are looking back on us through memories, and they're saying, wow, I was a part of the time where we built digital health as we know it today. And we built better healthcare software that empowers patients and informs physicians and just creates a healthcare that moves asynchronously like our Facebook or our Twitters and everything that we use outside of the healthcare ecosystem. So thank you for your time.